Hi, my name is Renae Green, and I am a lactation consultant with Healthy Starts Center for Urban Breastfeeding. And today I want to talk to you about breastfeeding and heart health. Hypertension and preeclampsia are very common complications that can occur during pregnancy. And what does this mean for someone who intends to breastfeed? Well, I'm glad you asked. So, breastfeeding is the optimal source of nutrition for infants. It helps them grow, and it also protects them from illnesses. Breastfeeding also contributes to the overall health and well-being of the mother, and when done for longer periods of time, can reduce risk factors related to high blood pressure, obesity, and also heart attack. Some of the most common symptoms of preeclampsia that we see are high blood pressure, high amounts of protein in the urine, which they screen for at your prenatal visits, and also swelling of the hands, the feet, the ankles, and or the face. There are other symptoms that can alert your provider that you would have or you are showing signs of early preeclampsia. And yet some people don't experience any of those symptoms at all. So it's always important to see and check in with your provider regularly. So what happens when you give birth and you've been diagnosed with hypertension or preeclampsia and you're intending to breastfeed? That's another great question. So, many medications used to treat either of these complications are generally safe to take when breastfeeding. You want to make sure you open that discussion with your provider so that they are aware that you intend to breastfeed and that you don't want to do any harm or damage to your milk supply. You also want to make sure that you have a lactation consultant or counselor, a part of your care team while you are giving birth. They can be very helpful in painting that picture to the providers or suggesting medication that would be best. I think the tricky part here is making sure you get breastfeeding off to a good start. And when I say good start, I mean you want to breastfeed early and often by any means. So within the first 6 hours of giving birth, you want to either latch your baby on to begin nursing from your breast, or if there is some barrier to doing that, you may also pump. And then after you do that initial feeding or initial pumping session, you want to continuously express milk from your breast every 2 to 3 hours. And this is so that as your colostrum is being supplied to your infant, you are also creating a demand with your body so that your milk production can start to mimic and match the demand that you are putting on there. So you want to make sure you are expressing milk from the breast often, to say the least. My advice as it relates to breastfeeding and heart health is to make the decision to breastfeed early in your pregnancy. Make sure you are seeing your doctor regularly for checks. You also want to take a breastfeeding prenatal class. They can be very helpful in preparing you for breastfeeding. And when I say breastfeeding, I mean it in a lifestyle sense. And also, last but not least, making sure that if you do take any medications for any of those complications or otherwise, that you speak to your provider and your lactation consultant to check and make sure they are safe. All right. Thank you.